Okay, we're getting into the location and function of the skeletal muscles. You have a chart that says location and function. It talks about origin, insertion, and action. So find that paper and fill these in. You will need to know where these all are on your body. There will be a few questions on origin and insertion, probably more of the more common ones, okay? So first we have the biceps brachii. The origin is the anterior scapula, okay? And the insertion is proximal radius. The action is an elbow flex. So the crease of the elbow flexes, okay? Triceps brachii. The origin is the posterior of the scapula, and the insertion is the posterior of the proximal ulna, okay? And that is the elbow extension. Stop and fill in as you need to. I'm just going to keep going. Trapezius is next. This is a picture of your back, this muscle that goes up and down. You have one on each side, okay? Trapezius. The origin is the cervical and thoracic spine. The insertion is the spine of the scapula. Don't get that confused with your spine, okay? Spine of the scapula. So the origin is over here, the cervical and thoracic, and then the insertion is over here. It extends and hyperextends the head and neck, okay? So bring in the hyperextends, and then also helps with shoulder retraction and elevation and depression, bringing it down even lower, okay? Elevation, depression. Okay, the latissimus dorsi. Oh, sorry, I'll have to go back. Latissimus dorsi down here, I thought I would highlight it more. So that's down here. If you remember, dorsi is back, dorsal, like a dorsal fin. Okay, so this is your latissimus dorsi muscle. The origin are the lower thoracic and lumbar spine, as well as the pelvis. So all the way down here where you see the white is where the origin, and then the insertion is up here in the proximal humerus. Okay, proximal, closer to the body of the humerus. The action is extends a flexed arm or hyperextends the arm from the anatomical position. Okay, so if you do this and you bring your arms back, that's your latissimus dorsi work in there, okay? And then extends a flexed arm, okay? So latissimus dorsi. Deltoid. This is the origin is the clavicle and spine of the scapula. So right up here, the clavicle and spine of the scapula. And the insertion is the lateral humerus. The action is shoulder abduction. Abduction, take away. So when you're lifting your arm up, okay, that is your deltoid right here, working that motion. Your pectoralis major, the origin is the upper ribs along the sternum and clavicle. Okay, right here, this is your sternum underneath here. And this is where the pectoralis major connects the origin. And then the insertion is the humerus. And this is adduction. So that's bringing it back. Okay, bringing it back. Okay. The rectus abdominis. The origin is the anterior lower ribs. The insertion is down in the pelvic bones, and the action is a lumbar spine flexion. So your lumbar spine, if you're coming forward, okay, like the ab work, right? So that's a lumbar spine flexion, your rectus abdominis. The diaphragm is the origin is the central tendon. And the insertion is the circumference of the lower rib cage. So this is their diaphragm is a muscle here that works and expands the chest for breathing. Okay, so as your diaphragm comes down, your chest can expand for more air. As that diaphragm goes back into place, it pushes out the air. Quadriceps are a group of 4 muscles. The origin is the anterior pelvis and proximal femur. Insertion is the anterior tibia, so the front of your shin. The action is a knee extension. So if you think about it, if you're in sitting position and you lift your foot up, your knee is extending because you're making then behind the knee a 180. Okay, so that you're extending there. Your quadriceps are doing that at the top of your thigh. Those are the muscles pulling that up. Okay. Then you have the hamstrings. It's a group of 3 muscles on the back of your thigh, right? And the origin is the ischium and posterior femur. The insertion is the posterior tibia and fibula, so behind the tibia and fibula. And this action is a knee flexion. So that helps to bring the knee back, or the foot back. Okay. So quadriceps are in the front, hammies in the back. Quads 4, and the hammies are just made up of 3. I don't know why they don't call them tri-strings. Gluteus maximus, your origin is the ilium and sacrum and coccyx. See there where it all attaches. The insertion is on the femur. The action is extends the hip. So it brings your hip, your leg out. Okay. Gluteus maximus. So that's their kind of like upper rear end muscle. Gastrocnemius. This is one that you need to know also because you'll just say it's your calf, but it's called the gastrocnemius. You need to remember that. The origin is the femur. The insertion is the calcaneus, which is the heel bone. And the action is a plantar flexes the ankle when the knee is straight. Okay, so when the knee is straight, if you plantar flex the ankle, that is your gastrocnemius. That is your calf getting that workout. You can feel it. Okay, the soleus, the origin is the tibia and fibula. The insertion is the calcaneus or the heel bone. I'll move this down so you can see it. Oh, dang. Okay, there. The action is the plantar flexes the ankle when the knee is bent. So when the knee is bent, the soleus plantar flexes the ankle there. Okay. So here is the picture of anterior view of the skeletal muscles. There's a lot more here than you will need to know. So don't worry about it. We'll go through the ones that you do need to know, okay? And move them up again. Okay, and then that was just the back view, the posterior skeletal muscles. Okay, we will stop there. I might end on, hang on. Okay, that is it for the muscles. I'll do a separate one for the diseases and disorders. I just had to get back on to tell you guys I love you, because I really do. I miss you. I hope you guys are doing well at home. Check in on our meeting platform and check in at least once a week with me. Let's get this done. We're going to start going through these systems quicker and get it done. Love you guys. See ya. Bye.